Good morning. Welcome. Thank you for what you do. You're kind of in a boat that's taking on a lot of water, and you got one little cup trying to get it out. Been in the coaching profession for 40 years. I felt like that every day when it came to mental health, addiction, around kids. It's tough. I just hope we start getting some answers to this. But, you know, I walk to work every day, not too far from here, and I see 6 to 8, 10 people on drugs, passed out. You can go within several blocks here, and you can probably find one person a day that's passed away from it. It seems like we want to do something about it, but we really don't know how to start from the bottom up. And again, I've dealt with it all my life, and it's a sad situation. It's something that if we don't get in control of it, we're going to look at a huge. We got an epidemic now, but we're looking at 200,000 to 400,000 that's going to start dying from this. Is there any work with any of y'all with Homeland Security that determines or gets any reports from what's happening at the border from fentanyl? I'm not getting into border walls and all. I don't get into all this political stuff. But I was down there not too long ago. I saw enough fentanyl in the back of a truck that killed everybody in this country. And most of us hadn't heard of fentanyl. Most people in here hadn't heard of fentanyl until last year or so. And it's getting bad. It's an epidemic. So anybody got any thoughts on that?
Yes, definitively. I mean, what happens with fentanyl, it is very lucrative for the illicit drug market. So it started in 2016, and it's just have grown increasingly. Extraordinarily potent drug, so a very few milligrams actually can generate a very intense high, but it can also kill you. It's much easier to transport across the border. Mm-hmm. You don't need to cultivate. The synthesis of this compound is relatively easy. So what we have seen was initially it was used to contaminate heroin, and now we're seeing it contaminated basically almost all illicit drugs. And that includes prescription, illicit prescriptions, and this is probably one of the reasons why we're seeing increases in deaths from overdoses among teenagers and young people. It's being used to contaminate methamphetamine and cocaine, and this accounts for the very steep rise in deaths. So it is a lucrative drug, and it's much harder to contain.
And it's synthetic.
And it is synthetic.
Chinese are making it, and a lot of it's been made in Mexico, and it's coming up through our border. And hopefully, sooner or later, we wake up. You know, they could put just a certain amount in our air duct system in this building and either make all of us sick or kill us all. I mean, that's how deadly this stuff is. I really don't understand it, but I want to thank all of you for your work. One problem that I ran into when I was coaching is I'd bring in 25 kids a year that I would sign, and a few years ago, it wasn't over 10 years ago, 1 or 2 of them would have insulin problems, diabetics, not very many of them on drugs. Recently, you can ask coaches now, half to 3/4 of them are on Adderall or Ritalin. Where's that taking us, Dr. Gordon? Where are we headed with this?
ADHD is an illness that strikes many young people around the globe and in the United States.
Is it a disease? Do you inherit it?
It's a good question. There's a genetic component as well as likely environmental factors that contribute to the risk for ADHD. The treatment of ADHD with Adderall and other drugs can be very, very effective. But we have both an undersupply and oversupply problem. We have many, many children who could benefit from treatment for ADHD who are not getting adequate treatment or evidence-based treatment. And then we probably also have children who are getting it that maybe don't need it or misusing it. And so you have both of those situations in the United States. I think what we try to urge at the NIMH is an adherence to evidence-based principles. So quantitative evaluation of symptoms, appropriate treatment with medication for those symptoms. And when that happens, children with ADHD can do very well.
Yeah, well, thank you. Well, all this is a symptom. It's kind of like you can buy it anywhere. In colleges now, a lot of these kids, I don't know which one of them they take, but they take it to stay up all night to absorb, cramming for a test. Which one would that be? Would it be Adderall?
It could be. There are several different versions.
Yeah, and it's just, that's another drug that we're going to have a huge problem with. But I just hope we understand we're dipping water out by a spoon in a boat, and we're going to be in real deep trouble if we don't get control of the substances coming in this country. We got enough problems without those, but thank you for y'all's help and dedication and dealing with this, because it is an ongoing problem that's getting worse and worse. Thank you.
Senator Murphy.
Thank you very much. Thank you to all of you for your tremendous